You can start, Pamela.
Hello, hi, welcome everyone. We are, well, maybe we'll just wait some time for people to start joining us. I think, yeah. Just wait 1 minute. So yeah, I think I could just maybe I'll maybe start by thanking you, all of you, for being here. Especially thank you very much for Yingsu for making the time to be here. I know it's quite late in China right now. It's also late in Nairobi. So thank you very much for being here and making this time, and also recording for being present in this webinar. We think that we believe this is a great opportunity also for us internally at UN Habitat to learn, to continue this engagement that we had started with WLSP for quite long and quite strong collaboration we have. So thanks for being here. Maybe I can also thank Jean-Marie for your great support and great commitment to the work that we're doing, and also for making space and making the time to be here, and also for more long-lasting collaborations that will come from these special session that we're having right now, and from the workshop that we had. So yeah, I would like to wait a few 1 to 2 more minutes, because I just want to confirm, Sherry, that I am seeing the full list of the participants, which are 5.
Yes, these are all of the participants for the panel.
All right, so maybe I'll wait 2 more minutes to see if there are people joining.
Yes, we can wait.
All right, so maybe we can continue now. I think we give a bit some time, and I will like to continue with the event. I'm pretty sure this event will be recorded, and that we can make this extend. We could disseminate it further later on. So I would like to keep the conversations going. I would like to first give the floor for my colleague, Jose Chong. He's head of the public space program at UN Habitat. So I'll welcome you, Jose, for just giving some opening remarks to set up this event on behalf of UN Habitat, representing the public space program, but also the planning, finance, and economy section where this program fits under, and the urban health work that we have been doing. So yeah, the floor is yours, Jose. Thanks.
Thanks a lot, Pamela, for the introduction, and thanks to all the participants to the event. Good morning, good afternoon, and good evening, wherever you are connecting. So I wanted to thank to the invitation to this event that is going to be focusing on the impact of urban environment on health and well-being. And this is part of the 4th International Conference on Canadian, Chinese, and African Sustainable Urbanization. I would like also to take the opportunity to thank to the partners and to congratulate them, particularly to McGill University, la Université de Montréal, the University of Ottawa, and Carleton University for organizing this conference, and especially to our speakers in today's session. The pandemic has reminded us how important is a healthy environment in determining the well-being of its inhabitants. The experience of COVID-19 pandemic highlighted how healthy urban environments can reduce the risk of disease, while unhealthy ones can increase the risk of comorbidities. We also saw how public spaces can become a key asset in time of crisis, and how flexible urban environments can provide us with ways to adapt to challenging circumstances, and even to provide us with opportunities to heal. As the theme of the conference this year reflects, the city in an era of cascading risk, the risks we face today are interconnected and closely tied to the space we live. But these spaces can also help us to address these risks. Despite the clear connections between human health and the urban environment, the fields of global health and urban planning has remained separated. Professionals in both fields have developed their own methodologies, and as a result, they often find difficulties to work together despite their shared goals of ensuring healthy urban environments. UN Habitat's Urban Health Program works to bridge this divide and create spaces where planners and designers can work together with global health professionals towards common goals. By placing health outcomes at the center of urban development efforts, we can create sustainable strategies for building healthy cities. One of the goals of the program is to create a network of health and urban professionals to encourage collaboration and knowledge sharing across the two fields and continue UN Habitat long tradition of forging strong interdisciplinary partnerships. Today presenters are key actors in the field of urban health. My colleague Pamela Carbajal coordinates the UN Habitat Urban Health Programs and has worked to develop tools like the sourcebook for integrating health into urban and territorial planning, which she will discuss today. The Wuhan Land Use and Urban Spatial Planning Research Center, WLSP, is a leader on urban research and has partnered with UN Habitat Global Public Space Program to develop the people-oriented urban public spaces program, which is focused on improving public spaces across the city of Wuhan, ensuring social inclusive and compact inner city centers, revalorizing and revitalizing city heritage, and creating new tourism destinations. Finally, HealthBridge is a leading organization in health research and equity advocacy around the world. Its Livable Cities program seeks to improve the livability of the cities by ensuring access to the most vulnerable to healthy transportation options, healthy foods, parks, and public spaces. HealthBridge and UN Habitat have initiated several projects together focusing on our shared goal of creating child-friendly cities. I hope this presentation will inspire you to think about the links that we can forge and the ways we can work together to meet the shared goals of health and urban and territorial planning. Thanks a lot, and I hope that it's during this session, you will learn about these experiences and also to have a fruitful dialogue. Thanks.
Thank you very much, Jose. That was very nice and inspiration words to get started and to reflect on what we will see, the two projects we will see today. So I would like to give the time now for showing the videos and just to mention that both videos and both institutions that we will showcase right now, they tackle urban health through very different entry points. So I'm super happy to have both in the same room today, because we will see these different angles where we could tackle urban health. So if we can get some support to share the video first from Ying Shu on the planner, Wuhan Land Institute, land use, and yeah. Thank you.
Hello everyone, I am Chen Yu from Wuhan, China. I'm an urban planner from the Wuhan Land Use and Urban Spatial Planning Research Center under the Wuhan Municipal Planning Administration. Today, I will share with you our study. My presentation consists of 5 parts. The first part is background of the study and an introduction to the project. In the context of promoting both the healthy city strategy and the recovery of Wuhan after epidemic, we start this research. This study is jointly initiated by the WLSP and the UN Habitat, taking an international perspective while considering the actual condition of Wuhan. The objective of the study is to put forward action recommendations in Wuhan through territorial spatial planning. Part 2. Research approach and the methods. Taking into account the technology advantages of WLSP and our planning recommendations of the UN Habitat, we designed to take assessment indicators of the health cities as subject of the study. Drawing on domestic and international experiences, we aim to identify the entry point, key players, and cost of the action of healthy city development through territorial spatial planning. First, taking an international perspective. Second, under the specific viewpoint of the public institutions. Third, focusing on the planning department. Corresponding the 3 major topics, 3 research methods are employed. Topic 1 uses conventional literature review and case studies. Topic 2 uses statistical analysis of data. In addition to the above 2 methods, Topic 3 incorporates international training and expert seminars through the UN Habitat platform. Based on the above research approach, the overall technical route is formed. Part 3. Main research contents. Authoritative documents state that healthy city is a dynamic process of urban genres that promotes human health rather than a static result. At the same time, we interpret the globally recognized connotation of a healthy city from the perspectives of international experience, Chinese development, and academic research. The development of the modern urban planning shows that urban built-up environment is closely related to the public health. The first public health campaign initiated by the UK shows that urban planning can help improve the public environment and deal with infectious diseases by reducing urban densities and regulating sunlight and so on. Second public health campaign, launched by the United States, shows that urban planning can help improve living habitats to deal with chronic disease by increasing urban density, promoting mixed land use, and providing leisure and exercise space. With the funding of the World Health Organizations in 1948, the focus of the overseas studies shifted from the efforts of the physical spatial environment on health to those of social equality and justice, environmental psychology, and other health-related fields. In 2020, UN Habitat and World Health Organizations released the Sourcebook of Integrating Health into Urban and Territorial Planning to further enrich parts to implementing the new Urban Agenda and SDGs. It is recommended that global cities should re-examine urban and territorial planning through the healthy lenses. Healthy city development in China has gone through 3 stages. The Healthy City Shanghai Consensus again emphasizes that healthy and sustainable urban development are complementary and inseparable. From 1989 to 2050, China has progressed from building sanitary cities to healthy cities, emphasizing the development of a complete urban healthy system. The co-authority for developing healthy cities in China is the National Sanitation Campaign Committee, also known as the Healthy China Initiative Promoting Committee, which involves 35 departments in China. According to the Healthy China Initiative released in 2019, the Natural Resources Authority in charge of the territorial and spatial planning should collaborate in these 2 major undertakings. Now, best literature review and study on development of healthy city and their administrative authorities. We have cleared the connotation of healthy cities and key departments, and then we studied the assessment index system of healthy cities issued by various authorities. The index systems from home and abroad show some highly consistent figures. First, the index systems are generally multi-dimensional and multi-tiered, and including expanded indicators reflecting local features. Second, in terms of the dimensions of the indicators, healthy environment is the shared focus, while other dimensions such as health standard, healthy service, and social-economic are also taken into account. Third, types of indicators are mostly physical indicators such as health influences factors, while spatial indicators account for only a small proportions. Fourth, in terms of the data sources, most of them are statistics from governments and public institutions. We conducted an in-depth analysis of the 3 major categories and 12 healthy city assessment index systems from both home and abroad, and extra indicators regarding the healthy environment dimensions and other dimensions for a classified system. We have found 3 categories of index systems. This is the first one. The second one. The third one. Finally, among more than 1,000 healthy city assessment indicators, we selected 30 indicators to build a library of spatial indicators for healthy city assessment. The 30 indicators correspond to 4 paths to healthy city development. The first is to improve the quality of healthy environment. The second is to promote personal health behavior. The third is to ensure the supply of the surface facilities. And the fourth is to provide spatial guarantees for policy actions. In summary, Healthy City takes promoting human health as its core objective, and there is a comprehensive governing process which continuously improves public health, environment quality, and social condition by facilitating personal health behavior, improving special careers, providing social services, and issuing policy actions. By discussing with experts from UN Habitat, we found 71 tools for healthy city planning through international experiences. We identified 4 stakeholders of healthy city planning, 4 dimensions of healthy city planning, and 4 entry points of healthy city planning, which offers replicable and transferable experiences of healthy city planning. However, in the context of Healthy China, the Public Health Department is the key authority for healthy city development in China. It also be noted that healthy city development is not only the task of healthy department, but also involves departments such as natural resources, housing and urban-rural construction, landscaping and greening, education and sports, which can truly complement the guideline of integrating healthy in all policies. From the technical perspective of planning, territory spatial planning serves to arrange the spatial utilization of a certain industry or a specific area, and coordinate with the planning platform of the competent department of the industry. As for the results of Wuhan's healthy city development, Wuhan's competitiveness in medical hardware and environment ranks 5th in the country. Existing specialized plans such as those on green space systems, sports facilities, medical and health care pay close attention to key indicators of health environment, quality, and surface facilities supply. Generally speaking, Wuhan's healthy city development has reached a good standard. However, in order to build it into a healthy city with even higher quality and greater resilience, it is necessary to draw on international experiences and implement key indicators as starting points to optimize the contents and working mechanism of territorial spatial plans. Moreover, complementary efforts can be made on simulation platform development, basic research, detailed design, and public participation. The above is the main content of my presentation. In addition, we will incorporate advices from experts, seminars to improve our planning recommendations in terms of highlighting Wuhan's epidemic control experience and identifying evidence-based spatial indicators. Finally, here are the references and acknowledgements. Thank you.
Thank you very much for broadcasting that video. And I think it was super interesting to see how they had rolled out the impact assessment on health and how they started really working on the different areas towards health. And we all know that COVID has gained some momentum, so it's about for us to keep it forward. So I would like to broadcast the second video now. From a health breach presented by Daniel Christie, the director of Livable Cities program and the head of the program.
thank you for inviting me to present today, and my apologies for not being able to attend in person. My name is Christy Daniel, and I'm the director of the Livable Cities program for Healthbridge, and I'm going to be talking today about some of the programs that we have worked on to create child-friendly spaces in cities. So Healthbridge is an international charity that works with partners worldwide to improve health and health equity. The projects I'm going to be telling you about today fall under our Livable Cities program, which is focused on improving the livability of cities through equitable access to healthy streets, open public spaces such as parks, and local public markets. The first project I'd like to tell you about comes from our Vietnam office in Hanoi. Vietnam overall did a very good job of controlling the virus, but the pandemic still had a negative impact on children, both physically and mentally. Parks were closed, children were kept home from school, they were being asked to be kept into their houses, and of course this, as we all know, takes a toll on children. So we initiated a project in partnership with UN Habitat and an organization called Think Playgrounds. And the purpose was to create mobile pop-up playgrounds that would improve safety for children, but also give them some much needed outdoor and playtime. And it was also intended to create social connections within neighborhoods. Because we were all being kept in our houses, we were finding that those social connections were starting to weaken. And so we wanted this project to create those social connections to really help mitigate some of the health impacts that we were seeing, especially in disadvantaged neighborhoods. So the pop-up playgrounds were designed to be quite simple in their design. We wanted them to be easy to set up for volunteers and have materials that were also easily available in the community. So this is just an overview picture of one of the pop-up playgrounds, and you'll see it's very simple. We've got things like ropes, there's things like boxes, there's sticks to play with. So these are not complicated materials that were being used for the pop-up playground. And in total, Healthbridge Vietnam trained 58 community members to organize the playground events. So it was really important that we ensured that the local community members were trained to be able to set this up so that it would have sustainability over time. In total, we organized the pop-up playgrounds in 5 communities, and there was 2 events per community. And overall, we had over 500 children participating. Now, the pop-ups were organized at various times during the pandemic, and Vietnam has actually been quite successful at controlling the pandemic. So sometimes they wear masks, sometimes they don't. You'll see in some of the pictures that there will be children with masks, with children without, and that's just reflecting the fact that this has been happening at different times in the pandemic. So we were able to build the capacity for local residents to manage and develop the mobile playground model in their community. And out of the 5 communities, 3 were able to maintain the pop-up playgrounds and are continuing to work to this day. The 2 that weren't, unfortunately, the community members that were trained, several of them actually moved away. So that's why we were unable to have 5 out of 5 that are still organizing the playgrounds. However, the idea has now expanded to a neighboring district, and they are organizing their own pop-up playgrounds. And so we actually have 4 communities that are continuing to do this. So overall, it was a really successful program. The children loved it. I really liked this picture that's in the top left corner. It's just children in boxes. It's always astounding to me how you give children boxes and they will be able to use their imagination and play with them for hours. So the next project that I'd like to tell you about is a project that comes from something that we did in 2018 with UN Habitat and our local partner called Mafra Foundation, and that was creating child play spaces in markets in Accra, Ghana. So in Ghana, the public markets are female-dominated spaces, and as a result, there's a large number of children between the ages of approximately 0 and 5 that spend a lot of their early childhood in these formal and informal markets with their mothers or other primary caregivers like their grandmothers. So we worked in 2 specific markets, Malata and Nima. Those are large, well-established markets in Accra with hundreds of children who spend sometimes up to 10 hours a day, either alone or in small groups around their mother's stalls. And it's been well recognized that children need stimulation in the early years of their life, and that has a direct impact on the development of their young brains. But the children in these markets, they're not child friendly, the markets, and they weren't really given the opportunities to have those early childhood stimulating experiences. And that was a major concern. So we worked with UN Habitat and MAFRA, and we used the video game called Minecraft, and that's a program that's been adapted by UN Habitat to work with the community to help design spaces. And in total, MAFRA added over 150 different micro play spaces throughout the two markets in order to create those opportunities for children to be able to play while still being within close proximity of their mothers, because that was a requirement for the moms, is that they still wanted to be able to see their children. And so these are just some pictures, some examples of some of the micro play spaces that were set up. The one on the top left, you'll see that's just outside of one of the mom's stalls where she is a seamstress and the children are playing games. Their games are located, another game in the left bottom that's located throughout an area where there's lots of vegetables and fruits being sold. And so the micro play spaces are located all throughout. And when we did the analysis, we found that there was over 1,500 child engagements with the spaces per week. So it was a wildly successful program. And the spaces that were created are easily adaptable for other markets, but they're also adaptable for other spaces in the community as well. And the final project I'd like to tell you about comes from a project that we did in Calicut, India. We also did this in partnership with UN Habitat, along with our local partner, ASAF, which is Evangelical Social Action Forum. We worked in this community in a place called Ansari Literary Children's Park, and it's one of the largest green spaces in the city. But the park did not have any infrastructure for children. So even though it was called a children's park, there was actually no infrastructure left for children to actually play. So we focused on adding some much needed play equipment to the park. And the primary focus for this was to actually create inclusive play equipment. So equipment that could be used by children either living with or without disabilities. And as a result of adding the play spaces, we've now created a really fun place for children, especially those living with disabilities, to feel comfortable and safe. We used a similar process as we did with the play spaces in the market program, where we worked with the Minecraft model and the community to redesign the space. And the community created seating areas, playing areas. They added much needed inclusive play equipment. They also further designed the park and added walking spaces, so things that were a little bit outside of our specific focus, but they continued on, and the government committed to actually making those changes. Of particular importance, we saw a dramatic increase in the number of girls and children living with disabilities using this space. And so that really demonstrated to us that when their needs are taken into account, they will use the public spaces. Since this particular project, the government was thrilled with how it turned out and how popular it was. So they actually committed to redoing, I think it was 13 of their public spaces, and ensuring that those spaces are inclusive in order to be able to accommodate children living with and without disabilities. So if you have any questions about any of the projects that I've talked about today, feel free to visit the website, or you can also email me, and I'll make sure that my email is available on the slide as well. It's not right now, but it will be. So thank you so much, and I hope you have a great rest of your day.
Sorry, I was muted. Thank you very much for showcasing those videos. I'll jump into my presentation right now, which will be focused on the source book, which is the last document jointly developed with the World Health Organization. And I think it's about time to that will link both of the presentations we just heard about the WLSP approaches and their priorities, but also these other more on the ground projects that had been going on. So I'm very happy that we had both scales of planning, from the territorial to the ground implementation, where we could also see both things. So I'm going to share my screen now, and I'll take you through my presentation. All right, I think you can see it now. So Planning for Healthy Cities and Territories is the program at UN Habitat where we are working on urban health, and it incorporates different aspects on urban health. So I'll go through a few of the main different areas of work we have. So Planning for Healthy Cities, its main objective is to ensure that national, local leaders and professionals have the knowledge, indicators, guidance, tools to integrate health and well-being into urban development and their decision-making process. So it has 5 main pillars, from gathering evidence, building a knowledge base, engaging with research institutes to do that, then from tool development, testing and application, and capacity building. I'll give one example where we had actually partnered with ICCCASU for this capacity building aspect. Then number 4, dissemination and advocacy, and building and going outreach on this area of why urban health is important and how can we do it. And the 5th one, a partnership and peer-to-peer learning. So just to give an example of these gathering evidence and knowledge base, I'll just share very quickly with you the Cities and Pandemics report towards a more green and healthy future, which is an agency document that I would say 3 main points. It has practical recommendations at the different planning levels on how to tackle the different, in this case was COVID, but how cities get affected by pandemics and how to tackle these. It has critical reflections on the narratives and the preconditions between different cities that come from these emerging lessons that the different cities had during COVID-19. Then I wanted also to bring here to the table the UN Habitat Public Space and COVID-19 guidelines, which is also another resources that builds on this evidence and knowledge on the different aspects that public spaces had shown and had trackled towards the pandemic. So accessibility, design flexibility, management, connectivity, spatial equality, equity distribution. So different aspects that there are key message on these for the pandemic public spaces. Then the one I'll focus a bit more on detail and in deep since it builds also from what WSP has mentioned, is the source book on integrating health into urban and territorial planning, which one provides a better understanding on why it's important to consider health in urban and territorial planning and urban and territorial planning in the health sector, so both sectors. Then also tell us who are the key players and what are their roles and responsibilities on working towards urban health, and how to bring the public health skills and the planning skills into the planning process. Then it tells us also how to act and how to react and what is out there. So it has more than 70 resources that actually tells you how you can work towards health and in different scenarios, in different settings, and through different entry points. So it tells us how and when to act. Well, the process a bit of the story that how we build this source book. We rolled out a huge test review. We partner with different societies and with different research institutions, and we gather around 150 resources that we categorize them into different categories, and then we review them, and then we bring them to 71, which are the ones published on the source book. These resources are categorized by analytical tools, briefing, design guidelines, evidence-based initiatives, networks, etc. Then to continue on the process, we had rolled out testing and application through different training modules and different materials. So this has been one of the pillars for the development of the source book and also the development of the program, since it's a way that we engage with the cities, and we engage with researchers, and we engage with academia on testing these tools and trying them and discussing with them and learning from each other. So here we can see two photos pre-COVID, where we actually did them on a conference setting. One was in a conference setting, and the other one was on another setting. And then here's an example where we use from the online setting, which actually ICCCASU provided an online setting for us to do a workshop prior this conference. We did a pre-conference workshop where we test out these, we pilot, let's say, the source book. We tried to implement one of the approaches that the source book highlights, and that was one, actually, the asset-based approach. So in here, we use an online platform, and we use all these resources that we had to do that. So this is one of the examples that we did it before COVID-19 and before we were developing the source book. It's quite also important to mention that the source book was developed before the pandemic, and then we keep that going. So this is a good example, and on how we can continue. We have continued those lines of work. Then to summarize, I'll give 4 key messages that are the key messages for implementing the source book and implementing these aspects on urban health. So the first one would be that it tells us how to link the public health aspects with the spatial factors. So how do we protect from harm, promote health, and provide health? And we link them with the spatial factors. I think we saw actually the implementation example from WSP presentation on this, which I found it super interesting. Then the second message is the intersectoral collaboration not only benefits one sector, but actually benefits both. And this correlates to a broader agenda and to a broader, it tackles different aspects. So as we can see in number 2, aligning both SDG 11 and 3, we can actually have a wider range of outputs. And then the message number 3 would be that health is not only an input, but it's also an outcome. So we're very much used that health as an input would be the data that the health sector provide and so on. But in this case, in the source book, we tell like, okay, health is not only an outcome, but it's also an input. So yeah, and the 4 point would be entry points. So there are different entry points that we can get to achieve urban health. So it could be through settings, it could be through public spaces, or as we saw in the presentation from Health Bridge, we had different settings in the market and in the kids' playground. So different entry points to actually tackle and improve urban health. So as I said, well, how do we use the source book? This is a quick example, another online training that we had, and we used the entry point approach where we brought participants to reflect on how can you get into, like, how could you access urban health through different entry points. What have we learned from the process? We have learned that there's tons of resources out there, there's tons of tools, and they are not fully reflected on the ground. So I really like these 2 presentations that we had, a territorial more approach, and then we also had the underground presentation where we can see how they can be implemented at different scales. We also learned that there's a need for articulating a framework for action, and that there's also a limitation for cities and decision makers to access these resources. So these lessons learned have been driven the next steps of our work, and I just wanted to share with you so you know what's on our mind. And as I said, next steps, yeah, we are continuously building these partnerships for delivering capacity building, and ICCCASU is a great example because we just are engaging in this conference, and I know we will be continues this engagement. then we're also, of course, reflecting on how COVID-19 and these manifesto from the World Health Organization on building a healthier and greener COVID-19 recovery builds on these identification of knowledge and policy gaps and technical support to research, policy, and practitioners on the ground to incorporate and fully implement these messages that the source book brings. So I have nothing more to say than thank you for the time and letting me share my presentation. Yes. Yeah, can you still hear me, right? You can hear me? Okay, good. Yeah, so I just got an announce that I didn't had good internet. So I mean, we have heard 3 different presentations. I would think that the first presentation, it's a complete territorial approach that incorporates different aspects of what I mentioned in the source book. And we saw the second presentation, which is actually a more of underground projects and yeah. So I would like to give just, if there's any question that someone has on the group that we're here, if there's any question, I would like to open the space now. We have about 13 minutes to in case there's any questions from the floor. Otherwise, I will actually like to maybe Yingzu, that I know you're on the ground. So I was actually very interested on these health impact assessment that you were presenting. And I wanted to ask, how can a health impact assessment be involved in a planning process, or can it be part of the planning process? Or when did you actually use this health impact assessment? I found it so interesting because yeah. Maybe you can tell us a bit.
Yeah, actually, I would like to thank you. Like, we cooperated together. Like, you help us to understand the source book very well. So when we do our program, we found that the stakeholders we use, stakeholders of Health City, we use think it's kind of like a planner, governors, community residents. We kind of ignore the public health professionals. And after COVID-19, we think the public health professionals, they should be really important parts of the one of the very important stakeholders. So we start to think how to like involve the health impact assessment into our planning. So we do some case study, like for Bibel from the Spain. They start to evaluate the current planning, and then to find some, if there is some bad, if there is something they do not really good for their future, or if they do something really good for their future. So after the evaluation, they do some, they generate a new plan for their city. So we think this will be a good part to involve the healthy impact assessment into our planning. Like, we can, after we make a plan for the city, and this is not the end. We should keep on monitor and evaluate and generate the new plan. So that's why we think HRA should be involved in the planning, and that's the way to involve the HRA in the planning. That's it.
Absolutely, I totally agree. I totally agree that it's something that actually help us monitor and help us not only build the project, or it's not only on a diagnosis phase, but it's actually something that should be across the different process planning steps and the different processes. Good, great, thanks. Well, yeah, I just maybe taking the floor that you're there, and before we conclude this session that we had, currently there is a lot of momentum on healthy cities. People are really has gotten a very after COVID-19, people are started to put more attention to what it's a healthy city, what are these aspects of a healthy city, how can we go forward at a healthy city. I have seen it in different ways. Also, they have been focusing as well a lot on climate reduction, as we saw at the beginning of the pandemic, that we got a lot of reduced carbon emissions. So just from your experience and from the work that WLSP has done, how can we keep this momentum and this attention on our healthy cities after the pandemic? And maybe I'd like to know what, like, at WLSP, what are you like, how are you going to keep this momentum and this work on healthy cities, and how are you going to do it, and what would you suggest that we take forward so we can continue? You know, in UN Habitat, we're more than willing to support all of those like all of them who are building from this momentum, but we also want them to keep this and to really support them to not only be a reaction for COVID-19, but a long-term process and long-term commitments towards healthy cities and urban health. So maybe if you can tell us a bit on that.
Yeah.
How can we keep this?
Yeah, well, we doing our research, we first we try to understand what healthy city is, and the outcome is that we think healthy city is kind of the goal that we want to achieve. Like, so people now pay much attention on health city because COVID-19, like people face a lot of healthy issues, so they think, oh, we should build a healthy city. So after that, now people has realized that healthy city is really important. So we kind of worry about what people will think after the pandemic. So we try to, like, we WSP kind of build some indicators, help the government to evaluate whether our city is healthy or not. This is our work to make government keep on their attention on healthy city. So for the residents, how can we do for, like, make them keep on realizing that healthy city is really important? First, we think during the COVID-19, the community play really important part to help us to release the pandemic. Especially people have to stay at their homes. Community will deliver the food and the medicine to each resident. So people start to realize, oh, community is really important. So we think we have, as the planners, we have to we have to, like, we are currently, we are the planners of the city. Now we should be the planners of the community. Like, we should let the community leaders know what is planning and what is planning meaning for them and meaning for the future. So we have to convey the professional knowledge to them. So after the community leader, they realize how important the healthy city is, they can encourage more residents to, like, keep on their eyes on the healthy city. So that's what we think
what planners can do for the future.
No, great. Thanks. Thanks for answering that. I think that's very clear on community driven, but also in terms of developing indicators and developing, let's say, milestones that cities can engage to and work towards to that build our cities more healthy. And I get, like, there are many determinants in our cities, that there are many aspects that determine our health and well-being. So these indicators might vary a lot, and they might come from different scales and different aspects as well. No, thanks for sharing that. Very useful, and I'm super happy to have you here on the conversations, because we have been working quite a lot, and so I'll just thank you for that. I'll thank as well HealthBridge, that cannot be here right now with us, but we also have collaborating with them quite a lot, and as they said, they are themselves available for any questions. I'm sure WLSP as well make themselves available if there's any questions, once this recording is out and people listen to out. So now I'll just give the time and the floor for Jean-Marie to give us some closing remarks from ICCCASU. As I had been mentioning, we had been working quite closely with ICCCASU, and we just deliver a workshop together, a pre-conference workshop together, and yeah. So Jean-Marie, the floor is yours. Thanks for being here, and maybe you can, yeah. Thanks. You're muted, Jean-Marie.
So, thank you so much, Pamela. This is a wonderful time to be together again for this type of discussion, the second time. On behalf of the ICCCASU organizing committee, I would like to express my sincere appreciations and gratitude to the team, work with you. They did a wonderful, really work. Otherwise, this presentation could be not possible. So I know there were a lot of work done by moderators, presenters, coordinators, and also, you know, we have the ICCCASU technical support as well. I would like to appreciate the work they've been doing to have this. As we know, UN Habitat is committed to work with the ICCCASU to continue exchanging capacity building workshops and encouraging knowledge sharing. And UN Habitat also, I know, they welcome the opportunity to learn about the work taken by ICCCASU in the different regions and checking the way this can really work and engage in the future collaborations. And UN Habitat Health team, where you are yourself, is in the process of engaging in asset-based approach workshops. We can see how effective really it is to identify the entry points to integrate health and territorial planning, including one of which occur, as we discussed before, our pre-conference training workshop, which we went very good. And other future workshop could be done with the ICCCASU conference. I would like to thank you, all of you, for really hard work you did again. And thanks also for the participants. And then I wish we can have a wonderful time for this type of knowledge sharing and discussion in the future. Thank you so much. Is it clear?
Yeah, thanks, Jean-Marie. Thanks for those very kind words. I think with those kind words, I have nothing to add and just conclude, and as well echo your thanks for everyone to being here and for all the support we had from ICCCASU. So thank you very much, everyone. Have a lovely evening, afternoon, or morning.
Yeah, thank you so much. Yeah, I think we have so many so many panels going on tomorrow. So hope those who are interested can continue attending the ICCCASU workshops again. Thank you so much.
Sure. Thank you.
Thank you.
Yeah,
all.
thank you.
Okay.
Yeah, thank you. Bye-bye. Bye-bye.
A lot.
Good night.
Good night.